Okay, so well done with that, Jenny. So what we're seeing from what we've assessed so far is clearly you were sensitive on the left side of your back compared to the right.
Mm-hmm.
And some of those tests were causing some radiation of symptoms down your leg.
Yeah.
But then what we've also seen in your leg is some things are a bit more sensitive, like the sharp, but the ice was actually a little bit duller.
Mm.
What do you make of that?
It doesn't really make sense, does it?
Yeah, and that's a common response. But what we can say, most things are elevated or a bit more sensitive, and the cold particularly was duller or reduced compared to this right side.
Mm-hmm.
So it shows us the signals or the messages you're getting back from that side are different to this side.
Yeah.
Even though it's the same pressure or the same stimulus on your skin. So broadly it tells us that in a lot of instances that can mean the system's a bit more sensitised, so sometimes that'll be described as increased pain sensitivity.
Mm-hmm.
Now that's important because that tells us that your system is being more efficient, if you like, and sending more signals or different signals back from what you're getting on the other leg. And that can be an important part of understanding that although your scan doesn't show significant ongoing issues in your back as far as pathology goes, there's still pain and increased sensitivity or efficiency in your system.
Okay.
And that might be highly relevant then for what we get you to try to do or what you've noticed that you've been doing in terms of you might be more easily stirred up with going for a walk, for example, whereas in the past that mightn't have been something that bothered you, but just that loading of using your leg more than you have if your nervous system is efficient, that can be enough to help flare things up without actually overloading anything or causing any damage, but your pain might be increasing.
Mm-hmm.
Does that fit with what you've seen?
Yeah, it does. I'm just wondering how the cold bit fits in.
Yeah, well, we don't have a full understanding of exactly what that means. What we find though is it's helpful for us to see that your system is responding differently to different stimuli.
Mm-hmm.
And we know people with different nerve sensitivity or even nerve injuries show a mix of what we call sensory gain or sensory loss, just that the system's not getting clean, efficient, normal messaging back, which just makes it harder for your body to interpret what's going on.
Okay.
So it's just a signal that something's different or it's functioning differently, rather than telling us that there's something specifically damaged or injured.
Mm-hmm.
Okay, Jenny, so we've gone through a range of assessment there. So we've both assessed your back in terms of looking at your movement and how you're functioning and finding out where you're sore,
Mm-hmm.
and we did those earlier tests around sensitivity. So from the testing that we've done, what do you make of what we've gone through or perhaps what that means?
Well, my back's sore on the left and mostly my left leg seems sore as well.
And that's clearly what we've shown. In simple terms, you've got a sore back and you've got some symptoms radiating down your leg that seem to be coming from your back.
Yeah.
Although the other tests that we've done, there's no signs of nerve compression, there's no signs of specific nerve sensitivity, but you're broadly sensitive in that left side of your back and down your leg. What did you make of those tests where we used the sharp and the cold and so on?
What do you mean by that?
So you had different findings on the left and right when we did some of those. What do you think that might mean?
It doesn't all really fit, so now I'm wondering, is it all in my head if there's nothing wrong?
Yeah, that's a good question. It's a very important one that people often ask. So what we can explain from this is clearly your back and your leg are sensitive, and we've ruled out that there's no concerning pathology. So that doesn't mean there's nothing wrong, because we've showed with different parts that your back's clearly sore. So we'll often describe that this is a painful problem, but not a dangerous problem. So, and that doesn't mean the pain's in your head, because we've shown you that your pain's in your back from some of the tests that we've done. But certainly that increased efficiency of your nervous system. So when we tap with a toothpick on your back, it gives you pain in your back, but also down your leg.
Mm-hmm.
So the system's clearly on more alert or being more receptive to what's happening there. And that's common in people with persistent pain. where they'll get this spread of symptoms, or as I said, this increased efficiency of the nervous system, which we sometimes call increased pain sensitivity.
Mm-hmm.
Yep. Now, that's important to understand that, because often if you're thinking, oh, there's a problem with my nerve or a problem with my disc, every time you get that feeling or every time you increase activity and your pain gets worse, the often response, which is what you've described, what do you normally do then?
I stop.
You stop,
Yeah.
exactly. And that's almost training the system to be on alert and understand when things are getting worse, you'd better get some rest or you need to back off. But how's that been working for you, Jenny?
Well, it hasn't. I haven't got any better. Yeah.
And that's commonly what we see. So you've been responding to the signals as you've understood them, but we know your back's sore, but it's more sensitive rather than damaged. So what we need is a program that helps calm that sensitivity down and get you back to normal function. And for different people, that looks like different things. It always involves exercise, but sometimes we can use specific desensitising exercises as well, or we might focus on other aspects that might make that sensitivity worse. And poor sleep doesn't help with that. If you're generally unwell, that doesn't help either. Reducing your activity by too much is generally unhelpful. And then mood-related stuff, which wasn't a big issue for you, but we know when mood is affected, that can also impact on this sensitivity. So we'll put together a program for you that addresses the most important parts to help you get going again.
Okay.